Hello, and welcome back to Ask Your Pain Doc. As you know, in this channel, we talk about traditional and alternative treatments for pain. Today, we're going to talk about a very exciting topic that's called postdural puncture headache, or the headache after epidural or spinal anesthesia. Please make sure you subscribe my channel if you like my content. If you want to support me, make sure you subscribe to my channel, turn on notification. Please send me all your feedbacks. Let's do this. Postdural puncture headache is a type of headache that happens after epidural or spinal injection. It can also happen after spinal tap. Lumbar puncture or spinal tap requires an insertion of very small needle into the space surrounding the spinal fluid and have a sample of cerebrospinal fluid. It can be diagnostic or therapeutic. Sometimes after epidural anesthesia, also after labor and delivery, and any type of epidural steroid injection or any injection that can be inside the epidural space, these type of headache can happen. Postdural puncture headache usually happens few days after the epidural or spinal injection. It has very certain characteristic. It intensifies or gets worse when the patient stand up, and it gets better or improves when the patient lay down. This type of headache or postdural puncture headache is very specific characteristic. Patients describe the pain as throbbing and aching pain, sometimes in their neck area, sometimes in their eyes. It can also happen at the back of your neck. It can be very severe and devastating. One of the distinguishing characteristics of this headache is positional. That means that when you stand up, the headache gets worse, and when you lay down, your headache gets better. And why is that? Because the pathophysiology of this headache is because there is a small leak in the lining of the brain when that needle is inserted inside patient's back. Because of that, there is part of the fluid that is inside our brain that called cerebrospinal fluid would leak slowly through that hole. So when you stand up and the gravity will pull your brain and all the layers down, your headache gets worse. And when you lay flat on your back, because there is less pressure and less gravity, your headache feels better. The good news is usually your body tries to seal that hole, and most of patients, after a few days of conservative treatments, including drinking plenty of fluids, anti-inflammatory medications, and rest, your body will slowly heal that hole and close that hole, so you see significant improvement. If the patient's symptoms is very severe, sometimes we put patients on some type of medication. This medication, the generic name is Furosemide, which is a mix of anti-inflammatory medication, caffeine, and butalbital that can increase production of the cerebrospinal fluid and can significantly help with the symptoms. As I said, most of the times, this headache is self-limiting. If you give it a few days, you'll see that your headache will get better. If your headache, however, does last more than a week, and some patients feel that their symptoms is very bad, it's very nauseous, and there is no response after this medication, we do some type of procedure that we call blood patch. And by blood patch, we inject some part of patient's blood into that area to help with the symptoms. Historically, they've been seeing that injecting patients' blood in that area will sort of seal that tiny puncture hole and significantly help patients with their headache. Post-dural puncture headache is not that uncommon, happens after epidural or spinal anesthesia. If that happens, don't panic, rest, drink plenty of water, take anti-inflammatory medications, and most of the times you will feel better after a few days. If there is no improvement, contact your doctor. There can be a procedure that we call a blood patch that can help you with this type of headache. I hope you've learned something today. Make sure you click on the subscribe button, turn on notification, send me all your feedbacks and comments, and I will see you all soon. Have a wonderful day.